Throngs of civic organizations, healthcare workers, sex workers and the LGBTQI+ community took to the streets in unison, holding up placards and posters. The Love Picketing Campaign is aimed to mobilize South Africans to engage in dialogue around sexual reproduction and debate on social issues towards people living with HIV, while encouraging greater openness and disclosure around their status. The AIDS Council says the rise in new infections post the COVID-19 pandemic has escalated as the burden has fallen on young women who often are ashamed of their status and fear discrimination.
Sexual health and reproductive rights are central and sacrosanct, and they must be respected by us as adults. We must stop discrimination, and every day, like we're doing today, it is too much to raise awareness, to bring others on board so that collectively together we make greater giant leaps.
Despite preventative interventions like oral PrEP once-a-day pill, freely available at all healthcare centers, these preventative measures are not reaching enough young women.
Young women are really often stigmatized by healthcare workers. So by bringing services to young people, to making services accessible to young people, is really something that they ask for. They also want to be treated by a young service provider, someone that they can relate to and really can get guidance from. The reason for high rates of HIV in South Africa and in KZN is also around poverty. So we really need to have a multi-sectoral approach to the individual, to the young person, that we also deal with their parents, their guardians, the larger community and the male sex partners.
Funding organizations like US President's Emergency Plan for AIDS Relief has accelerated progress towards achieving HIV and AIDS epidemic control in more than 50 countries. PEPFAR says 5.5 million babies were born HIV-free to mothers living with HIV.
Now we are seeing a decrease in new infections, although there's still a room for improvement and we still need to do more strides. And another thing is we are seeing that women who are pregnant are now not transferring the HIV to their children, and we are seeing a decrease in the death rates of the infants.
The youth have also raised their concerns.
Youth-friendly services are available in clinics, and we are here to just say, young people, go out there and access your services. Do not stand and say that the government or the people are not delivering or there's nothing to access for young people. Things are there. Organizations such as ourselves, show me a number. We are there providing young and youth-friendly services out there in the clinic. So please go out there and access your services.
We're here to represent the key and vulnerable populations. So for example, we teach people about how easily contractable HIV is and what are the means of probably getting services like PrEP for the youth and things like consent and making choices that it doesn't matter what gender you identify with or what sex you are assigned with. Your body is your body, your choice is your choice.
To those that are HIV negative, I want to assure them that they should always keep in mind that their health comes first as well. They should take their PrEP, they should condomize and make sure that they are living a healthy life.
A memorandum was also handed over to the Health Minister, Joe Phaahla. Amongst the demands listed was the decriminalization of sex workers, distribution of medication to far-flung areas, and non-discrimination towards the LGBTQI+ community. Jade Paulser, SABC News, Durban.